Okay, I have 12:01, so we're going to go ahead and get started. So good afternoon, everyone, and welcome to our Connect, Empower, Prevent Injury and Violence Prevention webinar series hosted by the UNC Injury Prevention Research Center. My name is Ciara Scott, and I'm a project manager at the center, and I'll be the moderator for today's webinar. And the purpose of this webinar series is just to provide a platform for information sharing and connection in order to generate discussion, foster connection, and inform and empower injury and violence prevention research and initiatives. And so this is one of several different educational events that we host at the UNC IPRC. And our webinars are hosted in this series on the second Wednesday of each month from 12 to 12:30 p.m. So every month at the same time, you can find us here with a different speaker presenting on a topic related to injury and violence prevention. And this current round of the series is going to be running until May of this new year. And you can always find information about the webinar series and upcoming presentations on our website. And the link is here at the bottom of the screen. So before we get started today, just a little bit of housekeeping. We are going to have, just shortly after we have a welcome from our center leadership, we're going to have a presentation today. And then following that presentation, we're going to have time for question and answers between the speaker and the audience. And so you can feel free to put questions in the chat throughout the presentation. I'll be monitoring the chat and collecting questions or when we get to that Q&A portion of the presentation. And this presentation is also being recorded and is going to be made available on our UNC IPRC YouTube page. And so just to protect the quality of our recording, video and mic unmuting abilities are disabled for the audience. So just FYI, in case you have tried to turn on your video or mic, you can't do that right now, but when we get to the Q&A, I will enable you to unmute so that you can engage with the presenter if you wish. And so now I'd like to pass it to Dr. Beth Morocco, who is the Associate Director at the UNC Injury Prevention Research Center, and she is going to tell you a little bit about our center and introduce you all to our speaker for today.
Thanks, Ciara. It's really a pleasure to be here. Say Happy New Year to everyone. I think I can still say that. We're still just a little over the first week of 2024, and we're delighted to be kicking off our webinar series for this year. It's proven to be pretty popular and people are very interested, and it seems like we've hit upon the right kind of amount of time to delve into these injury and violence prevention topics. Just a word or two about our center. As Ciara mentioned, we are the Injury Prevention Research Center. We're a transdisciplinary, multidisciplinary research center here at UNC Chapel Hill. We're under the Office of the Vice Chancellor for Research, so we're not part of a particular school or department. Instead, we engage scholars and practitioners and students and staff from across the university, and through our outreach and training education programs also engage with practitioners and policymakers. We are one of 9 CDC-funded injury research control centers, and we are one of 2 that have been continuously funded since they began the program at CDC at the National Center for Injury Prevention and Control back in they began this program back in 1987. So we've been around for quite a while. Our current physical location is 725 MLK Boulevard. So we're right across from Flyleaf and Root Cellar. So you can come see us and then go read a book and have some coffee. And we would love to see you. And we're also, as Ciara mentioned, engaged in a number of other types of educational and outreach activities. So really pleased to have you here today. And I'm especially pleased to introduce our speaker, Elyse Keefe, who is near and dear to the IPRC. She's been working with us now for several years in several different capacities, but she currently is a project manager at the UNC IPRC and holds master's degrees both in public health and social work, and both from UNC Chapel Hill. So she's a double Tar Heel. She works on several projects and programs that are focused on advancing safe systems approaches to road safety using a public health framework. In those roles, she provides technical assistance and leadership development efforts for road safety professionals and she has extensive experience using applied research methods for injury prevention. So I'm very pleased to introduce and pass the mic to Elyse Keefe.
Thank you so much, Beth. All right, let me share my screen. All right, can you all see my presentation? Okay. All right, good afternoon. Thanks so much for having me. As Beth said, I'm Elyse Keefe. I'm the Road Safety Project Coordinator at UNC IPRC. And yeah, excited to share with you all today a little bit about our capacity building model to support road safety, a road safety initiative in North Carolina called Vision Zero. So to begin, just want to acknowledge the rest of our UNC project team, as well as our funder, North Carolina Governor's Highway Safety Program, and the many partners that we work with. So we very much try to practice what we preach, which is that, you know, if we want to actually realize zero deaths on our roadways, we need all hands on deck. So we really try to pull from a variety of fields of research and practice and bring that all to bear on Vision Zero efforts. For anyone unfamiliar, Vision Zero is a roadway safety initiative. It originated in Sweden, and it really represents a paradigm shift in the field of transportation safety. So first, it sets zero as the only acceptable target for serious injuries and deaths on the transportation network. Some of you might be surprised to learn that many states in the US actually regularly set their annual goals or targets to actually have more people die on our roadways than the previous year. So saying that the goal is zero deaths, none are acceptable, is kind of in itself a big shift. The other big paradigm shift is that it really looks to move that onus of safety away from individuals and away from that focus, putting all the energy and effort onto, you know, changing driver behavior, and instead looking to those more high level, more effective systems level changes that are going to have a greater impact on safety. So Vision Zero is then grounded in what we call the safe systems principles. So I don't have time to get super in-depth into these today, but you know, essentially want to account for the fact that humans do make mistakes, that our bodies can only take so much kinetic energy transfer. That's kind of the public health epidemiological understanding of, you know, what's the actual cause of injury in the case of motor vehicle crashes. It's that kinetic energy transfer. So Vision Zero, yeah, moves away from the traditional approach of just like lots of PSAs and education campaigns, increasing enforcement, just trying to get everybody to behave perfectly, and yeah, looking to those solutions that don't require compliance, that don't depend on humans acting perfectly all the time. So I'm going to walk through, I think roundabouts are helpful. They're just a good example. So first of all, roundabouts change the built environment, right? So that's a more systems level intervention in the first place. So imagine an intersection with a traffic light. Someone could misjudge the time and distance as they're approaching that intersection. Maybe they're trying to make that yellow light. And so we know, for one thing, that the angle of a crash actually matters. They're not all equal. So that right angle crash you might expect if someone runs a red light is actually going to be more serious than a rear end collision, for example. And that's what that chart on the right shows. And then also, you know, thinking about what someone does when they're trying to get through that yellow light, they actually speed up. That's contributing to higher kinetic energy, creating more danger. So roundabouts, they actually compel drivers to slow down as they're approaching. So they're already lowering that kinetic energy in the intersection where those crashes are likely to happen. And then as people are entering, you know, if someone does make a mistake, we're planning for mistakes, right? That crash is going to happen at a safer, less serious, less dangerous angle and at a lower speed. So it's harm reduction, right? So safe systems and Vision Zero, it's not always trying to reduce the number of crashes, but just really focused on prioritizing reducing those most serious crashes and those ones that are most likely to lead to serious harm or death. And then kind of back to the principles, continuing with that roundabout example, safety is proactive. So you're not waiting for those crashes to happen. You're actually going to retrofit those most dangerous intersections to have roundabouts since they're safer. Maybe you change the policy so that roundabouts become the default for any new construction, new intersections. And then you also want to build in, as much redundancy as possible. So you don't stop at roundabouts. You also invest in public transit so that anyone who can't drive or shouldn't drive has other options. Consider vehicle regulations, consider protections for people walking or rolling in those intersections. Okay, so now back to North Carolina. So Vision Zero started in North Carolina, as I understand it, in 2015. So Governor McCrory at the time and the North Carolina DOT declared North Carolina a Vision Zero state. It didn't really come with new policies, new funding so much. So it was really kind of on individual communities to implement. And it was really pretty brand new in the US context. So there also was not a lot of guidance on how to go about doing that. And this is changing to an extent, but yeah, important to know that over the past 10 or so years, Vision Zero has been mainly led at the municipal level. So by the time our team at UNC became involved in supporting communities in 2018, there were only about 4 that had begun Vision Zero initiatives. So these here are some of the early adopters: Charlotte, Greensboro, Durham, and Greenville. And now there are about 30 communities working on Vision Zero and getting local safety plans into place. So we work with the majority of these communities you see here. Several are actually new with some new federal funding that was recently announced. And so, yeah, there are definitely different stages. So some are kind of, working on building up those coalitions, moving towards drafting Vision Zero safety plans. And then some of those more established communities are actually implementing the plans they have in place, trying to roll out new policies and finding funding for projects to support safety. So a little about our model. So our team's been funded by North Carolina Governor's Highway Safety Program for just over 3 years to support basically any community interested in that support and interested in being part of this statewide collaborative. And I will note that we're very proud North Carolina is the only state that we know of providing that state level coordination for Vision Zero. So this is our support model. You can see we've got 3 main activities in those circles there that I'll describe in the next slides. So first we have regular community touch points, and then we host an annual leadership institute, and we also coordinate a statewide task force. And then informing all those activities are those pieces you see around the outside of those circles. So we are evaluating and tracking implementation across the state. We provide resources and training related to the safe systems principles I was talking about, as well as Vision Zero implementation. And then we use systems thinking tools and strategies to try to improve planning and draw on models of change management, adaptive leadership to support stronger community coalitions. All right, so going through each of those kind of 3 main activities. So this first one are the regular community touch points. So we have monthly calls, and these are kind of smaller groups. So it's about a few representatives from 4 or 5 communities. And that's usually folks on the call are municipal planners, engineers, also have public health professionals, advocates, law enforcement, and different partners. That really depends a lot on the community, right? And so these are a little bit more loosely structured. Essentially, we have like a round robin of updates from the communities, and then kind of give them the opportunity to put forward anything they're struggling with to talk through as a group. And then they just share experiences and resources for things that are coming up. And then for our part, we really try to just pay attention to like what themes are emerging, what are we hearing like several times over, and then try to insert some resources or, if there's a recurring barrier that is coming from the state level, we're going to refer that to the task force. And then you can see some of the resources we've developed over the past few years. And feel free to use that QR code to see where they're all hosted. So those are kind of the monthly small ones. And then on a quarterly basis, we bring like everybody together. So all the communities, as well as more statewide partners. So GHSP, we have folks from AARP that join that, the state DOT, and yeah, anyone interested and involved in Vision Zero. Those are a little more structured. So we might have like subject matter experts present, present on one of these tools that we think is going to be helpful. Or we have like a panel of North Carolina community partners presenting on a topic coming up. So our most recent meeting, we had a panel on traffic calming policies and specifically working with fire departments on this, which can be a challenge. All right, next up is our institute. So if anyone here is familiar with Injury-Free NC Academy on harm reduction, we based our institute off of that model. This past June, we hosted our third institute. We actually had 16 teams, so it's been growing every year. And so that's our Vision Zero Leadership Team Institute. And we're now gearing up for our fourth this summer. So every year we just have kind of this open invite to communities to apply. Doesn't matter where they are in their Vision Zero planning. If we didn't even know they were up to anything, they're just exploring it. We just require that they bring multi-sector teams of at least 3 different sectors represented. So the Institute, it's a 2-day in-person event. It's a mix of content sessions, which this last year we held those in the morning and had like guest speakers, panelists, and then that is followed by what we call team time in the afternoons, where those community teams meet together with a UNC facilitator and go through kind of a structured activity to apply what they learned in those morning sessions back to their community context. And those typically have 4 strategic skill areas for each institute. They change a little year to year. So we had a focus last year on quick builds, which are low cost, quick turnaround safety infrastructure. So think about like a big mural painted on the roadway with some planters in front of a school to slow down drivers. But I think every year we've always had a skills focused on that multi-sector collaboration, partner building. And then we always have a focus on safe systems principles. So this year we're gonna, in the midst of planning, but probably revisit those quick builds and do a deep dive into more participatory planning. And last thing is, that statewide task force. So this need emerged pretty quickly after we started meeting with communities in that first year. I mentioned these have been led at the community level. And so there was a clear need to have some more coordination happening at the state level. So the task force has representation from folks that do work at that state level. So GHSP again, NCDOT, Bike Walk NC, so some more advocacy groups, ITRI over at NC State, Department of Public Health, and so on. So with that group, following some kind of initial level setting within the group, we then brought some of the community teams on to share directly with the task force about what they were up to, the successes and accomplishments to kind of build from, and then also, what are the barriers that everybody's coming up against. So taking those presentations, the task force identified, I think it was about 30 potential priority areas. And then we went through a prioritization process of kind of voting and evaluating each one. That's what you see on the right-hand side there. So those are like 4 examples that they each assessed based on impact and feasibility. So we wanted to kind of have a good mix of those like high impact, but it's going to take a long time to achieve, as well as some of those quicker wins. And so eventually landed on the 3 priority areas that you see on the left. And so each of those have work groups now that are trying to move those forward. But yeah, I think, Vision Zero, we kind of realized it's relatively new among a lot of leaders in the state as well as the general public. So those first two are essentially communications, knowledge sharing goals targeted at each of those audiences. And then the third priority is a policy that's more specific and somewhat unique in North Carolina, but communities had identified it as a big barrier to safety. It's essentially a 2012 legislative provision that prohibits any state dollars from funding bike or pedestrian infrastructure that isn't part of a larger project. So if you just want to paint a crosswalk or paint a bike lane in your downtown, you have to wait until the state is scheduled to do like a big resurfacing project on that road in however many years. So it can be a problem for communities, especially like smaller, more rural communities that don't have the budget to fund those projects alone. And then you've got federal dollars that are available, but they almost always require a state match. So they're kind of off the table. So yeah, for those three priority areas on our end, we're the in-between between the communities and the task force, trying to identify what the communication needs are and drafting materials. So we're going to present some of those to the task force at our next meeting, and then we'll move into refining those and making some plans for disseminating those in the future. So I will stop there and happy to take any questions you'll have.
Thanks so much, Elyse. So now we'll open it up for questions and answers. So if you have any questions, you can feel free to put those in the chat, or if you'd like to ask them out loud, you can raise your hand and I will call on folks one by one. And I will also enable the unmute function. All right, so we'll give it a couple minutes for folks to either put their questions in the chat or raise your hand. And in the meantime, Elyse, would you be able to talk more about where some of the different communities in North Carolina are at with their Vision Zero implementation?
Yeah, sure. So I think I mentioned one big change since even we started this project was that under now Federal Secretary of Transportation Pete Buttigieg, there's been a new national roadway safety strategy. And as part of that, they announced the Safe Streets and Roads for All program. And this is like the biggest federal investment, I think, in safety that we've seen. And so they have awarded, it is like hundreds of safety plans across the country. So the first round of awards was 2022, and this is a 5-year, I think it's 5 years, $5 billion across the country. So that has been, a big kind of influx in investment in what these communities were kind of doing without much support in years past. So so it's been growing a lot, and so we have, I'd say, the majority of communities are kind of newer and are in that kind of exploration kind of implementation stage, especially those what is the number? I mean, I think in this past year, it's 7 new communities that have been funded for safety planning. And then maybe as many the year before. So we're looking at like 10 to 15 communities that just received this funding and are looking to create those safety plans. So a lot are in that stage. Some of the more established communities have plans in place and are implementing some projects. Actually, I saw Ellen Walston on the call. I don't want to pick on her. I know she wouldn't mind talking about Greenville, and I can actually share some images as well. So they have done a lot around their delineator systems. Ellen, I'm waiting to see if you unmute. So they found, you know, did some prioritization, like what are our most dangerous intersections, and found that, yeah, really just kind of doing some controlled access with FlexPost. So pretty cheap implementation to do so, and saw huge reductions in crashes and also more serious crashes. I think there was one intersection that had multiple fatal crashes at it, and they put up some delineators, and the next year there was only one crash with minor injuries. So like huge reductions. They also have red light cameras that have reduced the more serious crashes. And I'm seeing some other questions coming in, so I can let you post those.
So we have one question from Alex Kofi, and she would like to know, are there any preliminary evaluation results that can be shared about Vision Zero efforts across the state?
As far as, so we mostly track implementation more than we're tracking actual, as a part of this project, at least, compared to, yeah, tracking reductions in fatalities and things like that. So let me just clarify what they're asking.
Yeah, Alex, if you want to unmute to give any more context, you can do that, or you can add to your question.
Sure. Thanks, Elyse. Yeah, I think I was just curious if you guys were tracking outcomes of these different types of strategies and how they've been effective. I realized that some of these might have been, you know, timing wise, it's difficult to track sort of those larger outcomes, like in the immediate. Those are more like long term. So just to know kind of what the evaluation approach was. And I think you provided some insight on that of like more process evaluation and like implementation than necessarily outcomes at this point, which makes a lot of sense. So thanks for sharing that.
Yeah, at the state level, we're yeah, kind of tracking more of like who's got a coalition, you know, what's been the investment? Do they have dedicated staff and dedicated funds towards Vision Zero and things like that? And then within those communities, though, they're more able to answer yeah, those on the ground questions about the impacts on safety. But it's a big, complex problem that is, I think, unfortunately, probably going to take a lot before we start seeing those outcomes, those kind of long-term outcomes.
Right, we have another question from Stephanie DeLong. She'd like to know if there are any tangible local examples of Vision Zero projects being implemented in the Triangle area.
Yeah, so several Triangle communities have Vision Zero plans and resolutions and are moving forward on things. Apex, Nightdale, Chapel Hill, Durham. So some are doing some planning at the regional level. So there's also I started this position and had to learn about MPOs. So there's metropolitan planning organizations. So there's some kind of regional plans actually that are just getting started. But certainly within those communities, a lot of people are have some really great projects going on. Coming to mind, the bus rapid transit in Raleigh. I think, you know, it gets forgotten, but public transit is a huge systems level safety intervention. They are also, they're doing a lot of safety projects at signalized intersections and trying to scale those up in Raleigh. Chapel Hill and Raleigh have changed policies like no turn on red. So yeah, I could go on. There's lots of good work happening in the Triangle for sure.
Thanks, Elyse. Okay, so we are at 12 o'clock. We have one more, or 12:30. We have one more question in the chat. And so Elyse, I don't know if you'll have any time to stay on to answer that. But if not, we can follow up via email. But for everybody else, I want to be respectful of your time because I know we said 12:30. So we're gonna end things for today. But thank you all for joining, and I will be sending a follow-up email that'll have Elise's contact information if anybody wants to get in contact with her to discuss Vision Zero North Carolina further. And I'll also be sharing information about our next webinar, which will be on Valentine's Day, actually. So hopefully that's easy to remember, February 14th, 12 o'clock. And we will be having a presentation from Laura Kessner, who works in Charlotte at the Center for Prevention Services as their Associate Director of Harm Reduction. And she'll be presenting on some of the harm reduction work they're doing out there in Charlotte. And again, I'll be sending a follow-up email with information on how to register for that webinar. So thank you again, everyone, and have a great rest of your afternoon. And Paris, if you are able to hang on, I think Elyse has time to answer your question live.